So our entire community is being affected by the lack of access for dental health care.
It knows no race, it knows no age, no gender.
It's not only individuals, it's employers, and it's families, it's children whose parents are in pain here. If, unfortunately, you have a large amount of stressors that may change what your priorities are, then yes, you're affected.
But many people never go to the doctor or the dentist unless they're in dire pain. It's just the way it is. And when you have to make choices on paying your rent or your utilities or putting food on the table or maybe paying daycare for your children because you're trying to work or you're a single mom, you don't really think about taking care of yourself.
It's those of us who unfortunately are in the lower income bracket who may suffer more than others. For example, I'm going to work every day and I'm in pain, and so maybe on Tuesday and Wednesday I don't make it because I'm in the ER trying to get some service so that I feel better so I can go back to work. But what that looks like as far as my work record is that I'm an employee that doesn't come to work every day and may not have the best attitude when I'm there because I'm in pain. And so long term, your work history could suffer. You may not look like the employee that you could be.
Absolutely. The dental problem that we have is a barrier to employment. From my experience, what I've seen is so many people, if they have broken or abscessed teeth or diseased mouth, they are very self-conscious about even going to have an interview with an employer because they're thinking everyone's looking at their mouth and forming opinions about what type of employee they're going to be. Yes, there is a major correlation between a healthy mouth and a healthy body. And I think the lower income residents in our community, sometimes there's a disconnect because they don't realize that when they have unhealthy mouths, it increases their chances of having cardiovascular disease, diabetes, rheumatoid arthritis, osteoporosis, gum disease. We actually had a client at Greater Greenwood United Ministry who was a patient, and she came in and needed to have some heart tests done, catheterization, and her heart doctor told her, "I cannot touch you without your bad teeth being extracted." So she came through the dental care clinic at the ministry and she had many of her teeth extracted, was able to go in and have her heart procedures completed. And the great thing about this is, this was 4 years ago. This lady still is a patient with Greater Greenwood United Ministry, but we've kind of started focusing more on prevention. We started a little walking program back in October. This particular lady actually came to our walking program, and she now understands it's not just about having the teeth extracted, having your procedures done, but it's all in how you live your life. And if you take control of your own health, your outcomes are going to be so much better. So she is on a regular walking program now.
So this is probably one of the best collaborations that we've had opportunity to go after, simply because we both want to improve the health and wellness of people in Greenwood. Right now, with this initiative, without each other, we wouldn't be able to do this.
Greenwood United Ministry has a 12-year-old dental program, and it is very limited on the amount of people that can be seen. I feel like with this collaboration, we're going to be able to see more people, offer more services because of this collaboration. The collaboration between Greater Greenwood United Ministry Free Clinic and Community Initiatives Free Clinic, I think it's just going to be a win-win situation. Both of our organizations have very unique programs and services, and I think we can use those programs and services to coordinate efforts and complement one another versus competing on some of these services.
We're both bringing things to the table that have to take place in there. A lot of times transportation is a huge barrier, and then follow-up is a huge barrier.
Community initiatives will be bringing the transportation to the table because so many of our clients are walking, so they don't have access. United Ministry has a free oral screening that's done once a month and it's offered to the community, we're going to be able to offer that piece. But it can be a follow-up piece, and we're going to be able to do teeth cleaning as well. It's also going to help us to strengthen the referral system that we already have in the community.
So Community Initiatives has a very large after-school and summer program where we're serving over 100 children a year and their families. So Healthy Learners has provided us an excellent opportunity to refer students to their care. And Healthy Learners already has an excellent program standing, and so just adding this small piece really does improve our connection in the community. At the end of the day, the Health and Wellness Task Force has looked at all the folks who are around the table. We've looked at the benefit of us working together, and what we found is that we're going to successfully and positively impact the lives of people in Greenwood County. If we teach one generation how to better care for their health, dental or overall, they're going to teach their children, and then their children will know that, and they'll teach theirs. So long term, the collaborations on Health and Wellness Task Force are going to outlast the Community Indicators Project.